Good morning. This is an example of how to examine the hands. Before beginning, introduce yourself to the patient. Good morning. I am Dr. Koh and I would like to examine your hands. Do you have any pain anywhere? No. Okay. Do not forget to use the hand rub. Ensure that the patient is positioned comfortably, the hands supported on a pillow and adequately exposed. May I just draw this up a little? Yeah. Look around for clues, such as walking aids or wheelchairs or oxygen supply that might give you a clue as to the underlying diagnosis. The principle of joint examination is look, feel, move. When looking, it is important to start in a systematic manner, working from distal to proximal. Start at the nails, looking for nail changes and nail fold changes. Look for scars, deformity, swelling, and look at the muscle bulk. Ask the patient to turn the hands over and look at the palmar surface, looking again for deformities, muscle bulk, and presence of scars. Thereafter, we can do some screening movements. Ask the patient to make a fist. Will you make a fist for me? And open. Observe the movement of the fingers. Thereafter, do some screening movements at the wrist and elbow. Get the patient to flex the wrists and extend the wrist fully by getting them to put their palms together and the backs of the hands together. Okay. See if the patient is able to fully extend their elbow and fully flex the elbow. Observe very carefully around the area, around the extensor surfaces for scars as well as rashes and other changes. Quickly check movement at the shoulders by asking the patient to put her hands behind her head as well as behind her back. The next stage of the examination is palpation or feeling. When one feels the joints, we are feeling for, firstly, temperature differences, and secondly, for tenderness. To palpate for temperature differences, we use the back of our hands. We begin proximally and move distally. The area overlying the joints should be cooler in a normal patient compared to the area where there is muscle. If it is reversed, for example, if the area overlying the joint is warmer, this could indicate inflammation. One palpates for temperature, thus beginning proximally and moving distally, like so. When palpating the joints for tenderness, similarly, start proximally and work distally. One begins by palpating the wrist, and we do so in a bimanual fashion, supporting the patient's wrist with our hands. The patient's wrist is positioned in a slightly flexed position to open the joint. I then begin by palpating the area around the ulnar styloid, looking at the patient's face as I do so, and moving across to the radial side of the joint. We then move down to the metacarpophalangeal joints. The metacarpophalangeal joints are distal to the knuckles, distal to the prominence of the metacarpal heads. We palpate again in a bimanual fashion, like so. Notice the positioning of my fingers. I am not palpating up here or here. The metacarpophalangeal joint is felt over here. See if you can find it in yourselves. Do not forget the thumb, and the axis of the thumb is different from the rest of the joints. So one has to turn the hand and palpate it like so. For palpation of smaller joints, such as the proximal interphalangeal joint and the distal interphalangeal joint, this is carried out in a bimanual fashion with thumb and index finger at right angles to one another, like so. Do not forget the thumb interphalangeal joint. Finally, do not forget either the carpometacarpal joint of the thumb. The hand is an organ of function. Each little joint in the hand contributes to the function of the hand as a whole, and it's more useful to assess the function of this as a composite. These joints and their movements may be divided into gross motor and fine motor movements. Gross motor movements are those where the thumb and the fingers act as a whole, compared to fine motor movements, which usually involves the thumb and one of the fingers, usually the index finger. For gross motor movements, one may assess the way the patient carries, for example, holding a tray. Can you lift this up like this? Or carrying a bag, or even opening a doorknob. Pretend my hand is a doorknob. Can you open the door? Twist it? Okay. And with the other hand? For fine motor movements, this may involve the thumb and index finger opposing tip to tip or tip to side in the manner of holding a key, or pulp to pulp. We can assess the patient's fine motor movements by asking them to pick up a coin. Can you pick up that coin and put it down again? And with the other hand, we can also assess their writing. Can you write your name? When you have completed your examination, do not forget to thank the patient. Thank you very much for helping us today. Do not forget to use hand rub. And thereafter, compose your thoughts and think about how you are going to present your findings to the examiner. I hope you found this useful, and I wish you all success in your examinations.